we're going to do a demonstration on intramuscular injections. So we have our little patient and we have our syringe with an amount of drug that we're going to give. So we have two locations for the most part that are most standard for giving IM injections in both the dog and cat. So those are the lumbar muscles or epaxial muscles that are here on the lower back on each side of the spine. And then of course you'll remember your semis, which are just along the very back of the leg here. And they're a group of two different muscles. Now, which muscle you use is a personal preference, but it also has a lot to do with the temper of your patient and how they're being restrained or what position they might be in. When we do lumbar injections, my little trick for this is to use an L with your hand that you're not going to be giving the syringe or the medication with. So I'm doing this right-handed for you guys. I've got an L with my left hand. I'm going to place the L on the spine of the animal, and I have my thumb just right over the pelvis of the animal. So if I do the L, I can know that I am not going to hit the spine and I'm not going to hit the pelvis. So then I can introduce my medication right into the muscle, right in the little triangle of my L. And I always still do this, where I feel the meat or the muscle with my finger, and then I have my syringe ready to go. I'm going to uncap my syringe, and you're placing it straight in at 90 degrees, straight up and down. Okay, you're going to aspirate and inject and remove. Okay, so straight up and down, 90-degree angle right into that epaxial muscle. Now, to do the semis, which I am fine with doing too, but I do generally prefer the lumbar. When I do the semis, I do the same thing. I'm going to isolate the leg, kind of hold it steady, and I'm going to feel the muscle back here, right? We're not going in here. This is not the semis, okay? So often I see students want to poke on the outside lateral part of the leg, and that's not correct. So again, anatomy is looking at the animal's backside, right? And the semis run just right up here on the backside of the thigh. So when I do this, again, I'm isolating the limb, however that might work, okay? I'm uncapping my syringe, I've got my medication, and I'm going again straight in, the 90-degree angle, okay? We want to make sure that we're going straight in, aspirate, and give the injection and remove. Now, do remember when you are on the restraining side of IM injections can sting depending on what we're administering. So I always, when I'm the restrainer and somebody's getting ready to poke the muscle, I always give an extra scratch, try to distract. And then I'm also ready just in case they react to the injection with an extra grip, right? Just in case they react. So that is how you give your intramuscular injections in either the epaxial or lumbar muscles or in the back leg, the semitendinosus and membranosus.